Hi folks, I'm Dr. Mark Cheng. One of the most common exercises that we see used more and more both in a strength and conditioning format as well as a rehab/prehab format is half kneeling. It's a very valuable developmental stage to work from, but let's go over the setup. To set up for half kneeling, you want the base knee and the foot to be on the same line. The front foot should be roughly underneath the front hip, or the corresponding hip. Certainly not really wide like this. And if tight roping is too difficult at the beginning, offset it a little bit. Give yourself the training wheels that you need to be able to access the right movement pattern. So the back foot can be either flat down or it can be up like this. Either way is fine in the context that I would generally work from. You will see different people explain it different ways. For what I'm telling you now, for the purposes of this clip, you have your options. From here, again, knee and foot in the same line. And now, again, as you have people work on this, for those of you that are trainers or clinicians, have them tuck their shirt in so you can actively see where the belt line is. If the belt is tilted, that gives you a visual cue to help them bring that more flat. Also, from profile, if the belt is tilted downward, so in other words, you've got an anterior tilt, from here you want to help them achieve that nice level pelvis. So whether it's viewing it from profile or viewing it front back, sagittally, you want to be able to make sure that there's not like a kick out of the hip, but a nice flat line. So from here, make sure that there's no penguining, that the arms aren't out here like they're about to draw a gun on you. Nice and relaxed, spine is tall, they're based out on the root knee. The front leg should feel loose, like you can almost detach it from the hip, and they're still going to be able to balance while still maintaining that nice level pelvis. This is the setup position for the basic half kneeling. Now for most people to be able to do this and really focus on keeping that front leg totally relaxed, if they've got tight quads or they've got some kind of lower cross syndrome, especially on one side or some sort of imbalance, this will be very edifying and challenging. They will start to sweat, breathing will become labored, all kinds of things. Work in here to the point where this becomes easy, relaxed, and calm. So again, wiggle the arms out, get tall, find breath, relax the front foot, and then the next progression from here, once you own this, at this point, just work on changing the line of sight. So being able to turn the head left and right. Again, just as with all of the exercises we're going to go over, go slow, take your time. That way you can really become aware of any deficits in control or areas where you're really having to muscle it. If you've got to muscle it, you don't own it. Take the time to learn with it, struggle with it, and then succeed with it. So with this, again, knee is flat, this is your base, the front foot should be relaxed, not really relying on that front foot for balance. Set the pelvis up, relax the chest, get tall, breathe from the abdomen. Again, watch my belt line, please. Breathing from down here, and again, relax shoulders. From here, the first basic progression I want you to be able to do is, again, being able to turn the head left and right, nice and easy, relaxed. You can also go into an H pattern. So again, your line of sight, looking up, looking down, going back to neutral, coming across the other side, looking up, looking down, coming back to neutral. Give that a try, let me know how that goes. But also, too, compare both left and right sides. You want to spend a little bit more time working, actually said maybe probably a lot more time working on the side that gives you the greatest challenge. But also, don't train into pain. For the next installment, please check out drmarkcheng.com. Thanks, folks.